Well, this segment is sponsored by the Springfield Clinic, and this week's Wellness Wednesday, our lifestyle producer and anchor Ashley Doss spoke with infectious disease doctors with the Springfield Clinic to discuss the impact of COVID-19 in our area.
Today we have Stephen O'Morrow, a doctor with Springfield Clinic in infectious diseases and travel medicine. Today he's joining us to answer a few of our questions related to COVID-19. Thank you so much for joining us.
You're welcome.
So when it comes to the peak, where are we locally when it comes to confirmed cases here?
We are approaching the peak with what is being reported by the Illinois Department of Public Health today, representing infections that occurred approximately 2 weeks ago. As of today, in Sangamon County, there are 48 cases of coronavirus 19 infection reported and 2 deaths.
Now, what is next for us as far as social distancing is concerned and getting back to a new normal?
Distancing continues to be an important implementation until we see a clear decline in the number of infections. Optimally, you could do this indefinitely, but there's a severe economic cost associated with that. Decisions that will be made nationally as well as locally. And it may be some combination of allowing people who have evidence for previous infection to go back to work and people in lower risk groups to go back to work with or without personal protective equipment. People who have comorbid conditions or who are older than age 65 may need to continue to socially distance themselves and or remain at home. And have people who visit them wear a mask to protect them until we see that these cases have gone down to 0.
So what can you say to the community and patients about coming into the doctor to address their coronavirus concerns?
When people come into the healthcare system, whether it's at the clinic or at the hospital, there are mechanisms to protect them from getting coronavirus infection. And there are practices in place at the clinic and at the hospital that allow for continued social distancing. So coming to the clinic if you have another illness besides coronavirus or coming to the hospital for the same reason is important, because if you delay care for those illnesses, then the problems can become more severe and the outcomes are not as good. So nobody should have a heart attack at home, and nobody should delay coming in for an infection that can worsen and then end up needing surgery. Again, we protect people when they come into the clinic and into the hospital to keep them from getting infection. And so it's a safer place than it would be if you attended some of the other places that are essential that are open in the community.
Excellent. Thank you so much, Dr. Morrow, for joining us today. And any last words of encouragement or anything you want to say to the community during this time? Yeah,
there's been a lot of emphasis on the news about testing. The problem with testing, if we do antibody tests or we do specific antigen tests, is that they have limited performance capabilities, and we don't understand this testing. So you will, as to how well it will perform. If you do a lot of tests on people who do not have infection, then you will come up with some that are falsely positive. Similarly, if you do a lot of tests on people who have the infection, you may come up with some false negatives. And we really have to factor that into our national approach with the use of testing as we move forward.
Excellent. Dr. Morrow, thank you so much for joining us here. We really do appreciate it.